Hello, so I'm going to start dermatology. Um, okay, to make it easy for you. Okay, so this is a picture of eczema. Okay, so they are asking what type of eczema is this. You can see here. So it's allergic contact dermatitis, acute allergic reaction, intensely itchy, edema and vesicles, and more chronic lesions are often lichenified. Okay, so see here. So it's allergic contact dermatitis. Okay, now what type of eczema is this? So it's contact irritant dermatitis. Contact irritant dermatitis, see here. Okay, so irritant dermatitis, itchy or sore and presents a slight scaling, edema and fissuring. Okay, so it's common in dishwashers. Okay, so now what type of eczema is this? So it's a nickel allergy. She had due to ring and due to the belt. So nickel allergy, one of the most common causes of allergic dermatitis in affected individuals. Dermatitis, also called eczema, develops in places where nickel containing metal is touching the skin. Okay, so it's contact dermatitis and allergic dermatitis. And this is contact irritant dermatitis, allergic contact dermatitis. Okay, common in barbers who visits barbers. Okay, so what type of eczema is this? This also contact allergic dermatitis. This is due to henna, due to rubber material. Maybe she is allergic to. Okay, so acute allergic reaction, intensely itchy, edema and vesicle, and more chronic lesions are often lichenified. Okay, so what type of eczema is this? So this is nummular. Okay, you can say discoid, like coin shaped. So discoid eczema is a type of eczema dermatitis defined by scattered, well-defined coin-shaped and coin-sized plugs of eczema. Discoid eczema is also called nummular dermatitis. Okay, so this is nummular dermatitis. Now, what type of eczema is this? So this is hyperkeratotic eczema. Hyperkeratotic eczema. You can see hyperkeratosis. Okay, so this is hyperkeratotic eczema. Okay, hyperkeratotic palmar dermatitis is a form of eczema in which there is thick scaling on the palms. Okay, so let's revise. What is this? This is allergic contact dermatitis. Okay, and this is contact irritant dermatitis and Nichols allergy. Okay, this is nickel allergy, contact allergic dermatitis, nummular or discoid eczema, and hyperkeratotic eczema. Okay, now what type of eczema is this? On flexures, extensors, cheeks. So this is atopic dermatitis. Okay, so acute atopic dermatitis is red, erythematous, weeping, crested, exudative, and may have blisters, vesicles, or bulli. Over time, the dermatitis becomes chronic and the skin becomes less red but thickened, lichenified, and scaly, and cracking of the skin fissures can occur. Okay, like you can see here, fissures. Okay, so in chronic, fissures in chronic. Okay. In acute, there will be weeping or crested exudative vesicles or bulli. Okay, so what type of lesion is this? See here. So this is seborrheic dermatitis. Seborrheic dermatitis. You can see seborrheic dermatitis. Okay. So infantile seborrheic dermatitis, also called cradle cap or napkin dermatitis. It clears by about 12 months, okay, of age, and characteristically the skull is yellowish and greasy or white and brown like, and itchy tends to be absent or mild. Okay, itching tends to be absent or mild. Okay, so this is seborrheic dermatitis. Above both pictures are of infantile seborrheic dermatitis and called cradle cap or napkin dermatitis. Okay, and itching is rarely seen. Okay, itching tends to be absent or mild. Okay, so what type of lesion is this? This is urticaria. 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 Okay, urticaria, transient pruritic swelling of the skin, results from edema in superficial layer of skin, also called wheals, hives, and nettle rash. Well demarcated erythematous lesions, always transient. This is always transient. Okay. So what type of lesion is this? Petrasis alba. Petrasis alba. Petrasis alba, Petras is scaly and alba is white. Okay, and so characterized by the presence of ill-defined scaly faintly erythematous patches, and these lesions eventually subside, leaving hypopigmented areas, then slowly returns to normal pigmentation. Okay, so it resolves by the arm. Now what type of eczema is this? So it is astotic eczema. Astotic eczema. Okay, astotic eczema is common type of dermatitis that occurs as a result of dry skin. Astotic eczema often has a distinctive and crazy paving appearance. Diamond-shaped fillets of skin are separated from each other by red bands forming a network, and there may also be scratch marks. Okay. Now what type of lesion is this? So this is lichen simplex chronicus. Lichen simplex chronicus. Okay, and lichen simplex chronicus is a chronic itchy skin disorder characterized by well demarcated erythematous patches and plugs of thickened leathery skin. Thickened leathery skin. Okay, so lichen simplex chronicus. What type of lesion is this? So pomfolix. Okay. So pomfolix is itching vesicles on finger, palms, and soles. Itching vesicles on finger, palms, and soles. Pomfolix. Okay. Blisters are small, firm, and intensely itchy. Okay. So what type of lesion is this? This is plantar psoriasis. Plantar psoriasis. Psoriasis is a chronic inflammatory skin disease in which there are clearly defined red scaly plugs with silvery scales. Okay, so this is plantar psoriasis. What type of lesion is this? And this is a palmar psoriasis. Plantar psoriasis and palmar psoriasis, scaly lesions. Chronic inflammatory skin disease in which there are clearly defined red scaly plugs with silvery scales. You can see here. Okay, so what type of lesion is this? Pus filled. See, so palmoplantar pustulosis. Palmoplantar pustulosis. Palmoplantar pustulosis presents as a group of sterile pustules occurring on one or both hands and feet, also called pustular psoriasis. Okay. Okay, so this is Pomfolix. These are not, pus filled. You can see here. Okay, so Pomfolix, and this is Palmoplantar pustulosis. You can see pus filled. Okay, so what type of lesion is this? Again, psoriasis. Okay, so psoriasis is a chronic inflammatory. Same explanation is here. Okay, and so again, what type of lesion is this? So lichen planus, a very itchy, pruritic, polygonal purple papules PPP, 2 to 5 mm diameter, flat-topped planar, mancolis to form plugs, and oral lichen planus. Oral lichen planus may appear as a white lacy patches. White fine lace-like striae called McCamm's striae are present in lichen planus, which are absent in above mentioned conditions. Okay, so what type of lesion is this? So this is guttate psoriasis. Guttate, can see guttate like. So guttate psoriasis. And numerous small plugs less than 1 centimeter, pink, scaly, thin patches are plugs of psoriasis. Scale can be subtle in early lesions and widespread lesions predominantly over the trunk and limbs. So guttate psoriasis. What type of lesion is this? Again, lichen simplex chronicus. Lichen simplex chronicus. And we show here as well lichen simplex chronicus. Okay, and lichen simplex chronicus. Leathery skin. Okay, what type of lesion is this? Alopecia areata. Okay, so alopecia areata, focal hair loss, well demarcated single or several round oval patches of normal appearing skin. Characteristic is exclamation point hairs may be observed, particularly at the periphery of bald patches. Okay, so now what type of lesion is this? Again, discoid lupus. Discoid lupus erythematosus is a chronic scarring skin condition. It is the most common form of cutaneous lupus. Discoid lupus. Which type of lesion is this? You can see here. So this is stasis eczema. Stasis eczema. So varicose eczema, also known as venous gravitational or stasis eczema, is a long-term skin condition that affects the lower legs. It is common in people with varicose veins. Okay, so stasis eczema. So these signs are present in which dermatological conditions? Auspit sign. Okay, in psoriasis. Okay, and so if the surface of psoriatic plug is scraped with a blunt scalpel, scalpel fall off a layer of white lamellae, they exhibit coherence after removal, much like candle wax. The Auspit sign refers to the appearance of small bleeding points after a successive layer of scale have been removed from the surface of psoriatic plugs or papules. Okay, you can see here. So this is Auspit sign. Removing the scale, bleeding occurs. What is this phenomena is called? So Nober phenomena. Nober. The Nober phenomena is the appearance of a skin lesion on lines of stroma. Okay. So which type of lesion is this? Honey colored. So impetigo. What type of condition lesion is this? So herpes labialis. Herpes labialis. Recurrent type is herpes simplex virus 1. Okay, which type of lesion is this? Folliculitis. Single follicle is filled with pus. Okay, so folliculitis. Folliculitis. So superficial infection of the hair follicles usually caused by Staph aureus, present as pustules in hair-bearing areas, legs and beard area. Okay, so which type of lesion is this? You can see scarring as well. So hidradenitis suppurativa. Okay, so disorder of the terminal follicular epithelium in the apocrine gland, bearing skin characterized clinically by open double-headed comedones, painful firm papules and nodules, pustules, fluctuant and pseudocysts and abscesses, and draining sinuses linking inflammatory lesions, hypertrophic and atrophic scars. Okay. What type of lesion is this? You can see here. So this is furuncle. Okay. Boil, also called a furuncle, is a deep form of bacterial folliculitis infection of a hair follicle. Okay, deep form of bacterial folliculitis. Okay, this is superficial, and you can see here it's deep. Okay, so furuncle. Which type of lesion is this? You can see it's following the derma term, so it is herpes zoster. Herpes zoster is character of a dermatomal distribution, that is the blisters are confined to the cutaneous distribution of one or two adjacent sensory nerves. This is usually unilateral with a sharp cut off at anterior and posterior midlines. Now, which type of lesion is this? This is chicken pox. You can see here. And this is chicken pox. So chicken pox is caused by herpes zoster virus, which causes multiple blisters filled with clear fluid. These blisters have a characteristic dewdrop on a rose petal appearance. You can see here a dewdrop on the rose petal appearance. Okay, and which type of lesion is this? This is carbuncle. You can see more than two faces. Okay. If hair follicle is involved, then folliculitis, and if that is deep, then will be called furuncle. But if there are more than two heads, then it is called carbuncle. You can see here. See here. So this is carbuncle. If there are multiple heads in a boil, the lesion is called a carbuncle. Okay, and if one head, then furuncle. That would be deep. Which type of lesion is this? So ecthyma. 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 Okay. So ecthyma is a skin infection characterized by crusted sores beneath which ulcers form. It is a deep form of impetigo, and they resolve slowly, leaving a scar. Okay. So this is impetigo as well. Okay, but this is chronic, which leaves scars. Characterized by crusted sores beneath which ulcers form. Okay, it is a deep form of impetigo. Okay, so deep form of impetigo leaves scarring. Okay, now which type of lesion is this? You can see here rolled edges, pearly rolled edges. So most common type, it's a basal cell carcinoma. Okay, Most commonly type of facial skin cancer, shiny or pearly nodule with a smooth surface, may have central depression or ulceration, so its edges appear rolled. Blood vessels cross its surface. You can see here blood vessels crossing the surface. What type of lesion is this? It's erysipelas. Erysipelas, okay, is a superficial form of cellulitis. Okay, affects the upper dermis and extends into the superficial cutaneous lymphatics. The affected skin has a very sharp raised border. It is bright red, firm and swollen. Okay, very sharp raised border. You can see here sharp border. Okay, so what type of lesion is this? This is cellulitis. Okay, you can see here margins are dull here, so this is cellulitis, but here margins are sharp. This is erysipelas. Okay, so this is cellulitis. Cellulitis is a common bacterial skin infection of the lower dermis and subcutaneous tissue. It results in a localized area of red, painful, swollen skin and systemic symptoms. The color is dull and margins are blurred. Margins are blurred. Okay, what type of lesion is this? Again, erytherisma. Erytherisma. Okay, present a well-defined pink or brown patches, the fine scaling and superficial fissures. Mild itching may be present. The bacteria responsible for eczema are corynebacteria. Okay, so this is erytherisma. Erytherisma. Okay, and this one was eczema, where it is. Yeah, this is eczema, and this is erytherisma. Okay, which type of lesion is this? You can see raised borders. So this is tuberculous leprosy. Okay, single anesthetic patch or plug with a raised border. So tuberculous leprosy. Which type of lesion is this? Lepromatous leprosy. Okay, widespread, symmetrical, shiny papules, nodules, and plugs are not anesthetic. Okay, tuberculous leprosy, single anesthetic patch, but lepromatous leprosy is not anesthetic. Okay, which type of lesion is this? This is a borderline leprosy. Okay, lepromatous leprosy, tuberculous leprosy. Tuberculous leprosy will be anesthetic. Lepromatous leprosy will not be anesthetic. Okay, and this is borderline leprosy. Okay, they are varying numbers of lesions. Okay, now which type of lesion is this? So these are common warts. You can see here these are common warts. Verruca vulgaris presents as a cauliflower-like papules with a rough papillomatous and hyperkeratotic surface. So these are common warts. Which type of lesion is this? So these are plain words. Plain. You can see these are plain words. Plain words are typically multiple small flat-topped skin-colored papules located most commonly on the face, hands, and shins. Plain words are mostly caused by human papilloma virus type 3 and 10. 3 and 10. Okay. So plain words 3 and 10 human papilloma virus. Plain words has words are 10 PLAIN and WARTS. So these are 10 words, and human papilloma virus has 3 words. So 3 type 3 and 10 in plain words. Okay, so which type of lesion is this? Filiform. These are filiform words. Okay. Is a cluster of fine fronds emerging from a narrow pedicule base usually found on the face. They are also described as digitate finger-like words. Okay, so these are filiform words. So which type of lesion is this? These are plantar words. See here, these are plantar words. Okay, so plantar words, Verusa plantaris includes tender inward growth on the soles, sometimes clusters of superficial, less painful mosaic warts. Plantar warts are typically tender with lateral and direct pressure, are surrounded by yellow hyperkeratotic callus-like skin showing accentuated skin markings, but with discontinuation of the skin lines through the actual wart. Okay, so these are plantar warts. These are common warts. These are plain warts. These are filiform warts, and these are plantar warts. Which type of lesion is this? This is corn. Okay. So corn is a clavus heloma is an inflamed and painful thickening of skin due to pressure. Common in those who wear tight shoes or pointed shoes. So this is common in them. So this is corn. It is painful. Okay, so this is callus. What is this? Which lesion is this? So this is callus. Okay, callus is a non-inflamed and painless thickening of skin due to pressure. Callus and tyloma is painless. These are painless. Okay, corn is painful, and callus is painless. Okay, which type of lesion is this? Herpes gingivitis. Herpes gingivitis is primary type 1 herpes simplex virus, most commonly present as a gingivitis. Symptoms include fever, which may be high, restlessness, and excessive dribbling. Drinking and eating are painful, and the breath is foul. The gums are swollen and red and bleed easily. Whitish vesicles evolve to yellowish ulcers on the tongue, throat, and palate, and inside the cheeks. Local lymph glands are lush and tender. Okay, so this is herpes gingivitis. Which type of lesion is this? You can see here on the finger. So it is herpetic whitlow. Herpetic whitlow. So here is the explanation. Herpetic whitlow is also herpes simplex virus infection of the finger. Occurs following inoculation of the virus from primary orofacial or genital infections. Okay, so herpetic whitlow. This is molluscum contagious. Okay, skin colored, umbilicated. So a molluscus contagiosum. Which type of lesion is this? This is Milker's nodule. So orif. Okay, a solitary red, rapidly growing papule less than 1 centimeter diameter, often on a hand, involves into a painful purple pustules, usually a history of close contact with the sheep, with a former cows, when trumped mucus nodules. Okay, so this is orif. Which type of lesion is this? This is sunburn. Okay, suntan. Can see difference in skin color. So this is sunburn, suntan. And suntan increase melanin production due to excessive sun exposure. Okay, so which type of lesion is this? Addison's disease, darkening of the skin. In 95% of patients with Addison's disease, skin darkening is more prominent on pressure areas in skin folds or scars within the mouth. Okay, so which type of lesion is this? So this is melasma, mask of pregnancy. Melasma, pattern macular symmetrical facial pigmentation. Okay, what type of lesion is this? Acanthosis nigricans, common in diabetics and hypothyroidism patients. Diffuse velvety thickening and hyperpigmentation, predominantly linked to a state of insulin resistance, diabetes, or obesity. Okay, so acanthosis nigricans. What type of lesion is this? Vitiligo. Smooth defined wild macular papules of no melanocytes, skin bright white under Wood's light. Skin bright white under Wood's light. Okay, often symmetrical distribution and hair may be affected. What type of lesion is this? So this is albinism. Can see albinism. So in albinism, a rare genetic syndrome, autosomal recessive inheritance, melanocytes unable to produce skin, hair, eye pigments, white hair, pale skin, and pink eyes. Which type of lesion is this? These are comedonal acne with open comedones. Open comedones are black in color, white comedones are white in color. Closed comedones are white in color and open are black in color. Okay, so open comedones are black heads are small follicles with dilated openings to skin, allowing oxidation of the debris within the follicle, leading to the black color. What type of lesion is this? So this is comedonal acne with closed comedones. So these are white in color. Closed comedones are white hairs, are small black follicles, the contents of which are not exposed to the skin. That's why they are white. Which type of lesion is this? Papulopustular acne. Papulopustular acne can be predominantly inflammatory with papule and pustules. And which type of lesion is this? Nodulocystic acne. You can see nodulocystic acne. Nodulocystic acne. Okay, nodular acne form when bacteria get trapped inside the closed pore, and this may lead to an infection that affects the deeper layer of the skin. The infection can cause inflammation at deep skin layers, creating hard nodules and cysts. Okay, so nodulocystic acne. Which type of lesion is this? See here. So acne rosacea, you can see pink colored bilateral. So acne rosacea. Cutaneous features of acne rosacea include transient recurrent erythema, flushing, persistent facial erythema, telangiectasia, inflammatory papules and pustules, papulopustular. Okay, so acne rosacea. What type of lesion is this? Rhinopyma. Rhinopyma. One of main complications of untreated rosacea is rhinopyma. Okay, rhinopyma. It causes the nose to enlarge and become red, bumpy, and bulbous. Red, bumpy, and bulbous rhinophyma. What type of lesion is this? Contact dermatitis. Okay. Contact dermatitis is an itchy rash caused by direct contact with a substance or an allergic reaction to it. Okay. Could be due to any soap, any makeup, or anything. Which type of lesion is this? SLE, okay, butterfly rash. Telltale sign of lupus is a butterfly shaped rash across the cheeks and bridge of the nose, sparing nasolabial folds. Okay, you can see nasolabial folds are spared. So this is SLE, common in SLE. Which type of lesion is this? Seborrheic dermatitis. You can see seborrheic dermatitis. Seborrheic characteristically the scale is yellowish and greasy or white and brown like associated with a variable annular or annular pale pink to bright red patches. Itching tends to be absent or mild. Okay, so seborrheic dermatitis. Which type of lesion is this? You can see here around the oral cavity. So it is perioral around the oral cavity dermatitis. Perioral dermatitis. So dermatitis is a red rash that circles the mouth. The skin can be scaly, dry, and flasky with swollen and plum bumps called papules. Perioral dermatitis can look like acne and is often mistaken for it. Okay, so perioral dermatitis. Which type of lesion is this? C. So acne fulminans. Okay, so acne fulminans. So this is emergency. Acute fulminans seen in adolescent boys. Severe acne associated with fever, arthritis, and vasculitis. Okay, fever, arthritis, and vasculitis. Acne fulminans. Okay, what type of lesion is this? Milia. Okay, some milia. Small cyst containing keratin, tiny pearly white bumps just under the surface of the skin, and these are skin colored. And these are neonatal milia. Can see here? These are neonatal milia. And which type of lesion is this? Infantile acne. Infantile acne. Okay. Okay, so what type of lesion is this? Mongolian spot. Mongolian spot. Congenital dermamelanocytosis, birthmark that is flat blue or blue-gray. They appear at birth or in the first few weeks of life. Okay. So now, what type of lesion is this? So erythema toxicum neonatorum. Erythema toxicum neonatorum. Okay, erythema toxicum neonatorum may be present at birth but more often appears during the second or third day of life. Erythematous 2 to 3 mm macules and plugs that evolve into the pustules. Each pustule surrounded by a blotchy area of the eczema, leading to what is classically described as the flea-bitten appearance. Palms and soles are not involved. Okay, erythema toxicum neonatorum. What type of lesion is this? So, transient neonatal pustular melanosis. Transient neonatal pustular melanosis. Okay. Transient neonatal pustular melanosis, benign pustular condition. Key clinical feature is pustule present at birth, no new lesions after birth, no systemic abnormality characterized by pustules on no erythematous base. Okay, what type of lesion is this? Strawberry colored, so strawberry nevus. Infantile hemangioma, also called infantile hemangioma, benign vascular tumor. Clinical, a soft vascular swelling is found, typically solitary, mostly head and neck region. 60% found and resolve spontaneously in time, can leave a residual mark. Okay, what type of lesion is this? Nevus simplex. Nevus simplex is most common vascular nevus. 50% of neonates due to dermal capillary dilation equally affects male and female infants. It presents at birth as a pink or red patch, also called salmon patch. It's a stroke bite when on the nape of the neck. Angel's kiss was on the glabella and eyelids. Okay. Which type of lesion is this? Neonatal phlemus. Nevus phlemus. Okay, nevus phlemus. Can see here. Okay, so nevus phlemus, a port wine stand and capillary vascular malformation present a pink, red, or purple patches, unlike nevus simplex. Okay, and this is nevus simplex. Okay, and this is a port wine colored. Okay, color vary from purple, pink, okay, and red. Okay, and so it tends to be unilateral, often persisting, darkening and thickening with increasing age. Okay, so now which type of lesion is this? Infantile acropustulosis. Infantile acropustulosis, itchy, uncomfortable skin condition affecting palm and soles. Temporary condition comes and goes, usually disappears by age of 3 years. Heal with small temporary pigmented areas. Okay. Which type of lesion is this? Hand, foot and mouth disease. Okay, so mild, short-lasting viral infections most commonly associated with Coxsackie virus, mostly affect children under age of 5. 95% present with fever, headache, sore throat, and malaise alongside the rash. Lesion on the dorsal and palmar surface of the hand and feet. Small, painful vesicles and ulcers in and around the mouth, palate, and pharynx. Okay, so hand, foot, mouth disease, Coxsackie virus infection. Which type of lesion is this? Slapped cheek parvo virus B19. Okay, slapped erythema infectiosum. Okay, also called slapped cheek syndrome. Okay, common childhood viral infection caused by parvovirus B19. Mild fever and headache at first. A rash appears a few days later with firm red cheeks, which feel burning hot and last 2 to 4 days, followed by a pink rash on the limbs and sometimes the trunk. This develops a lace-like network pattern. Okay. Which type of lesion is this? Striae gravidarum. Striae gravidarum. Okay. So striae gravidarum are atrophic linear scar that represents one of the most common connective tissue changes during pregnancy. Okay, so striae gravidarum, and this is linea alba or linea nigra. So it's a dark vertical line running down your belly, also called a pregnancy line, called alba when color is white. This is linea nigra, okay, because line is white or black, dark. Okay, line is dark, so this is nigra. What type of lesion is this? Polymorphic eruption of pregnancy. Okay, this is striae gravidarum, and this is a polymorphic eruption of pregnancy. Okay, so also called PUPPP or pruritic articulated papules and plugs of pregnancy. Okay, which type of lesion is this? Prurigo of pregnancy. Prurigo of pregnancy. Can see here. Okay. So, prurigo of pregnancy, benign, non-specific pruritic itchy papular rash that arises during pregnancy, appears in the second and third trimester, resolves after delivery. Okay, and what type of lesion is this? Pemphigoid gestation is C. Pemphigoid blisters are filled with clear fluid. So, pemphigoid gestation is a rare characteristic bullous eruption associated with pregnancy. Pregnancy starts in mid-pregnancy and appears as a generalized, intensely itchy rash. Remits after delivery, but often occurs in subsequent pregnancies. Refers for specialist management. Okay, so what type of lesion is this? So these are pemphigus vulgaris. Okay, pemphigus vulgaris. Okay, so pemphigus will associate with other autoimmune disorders like myasthenia gravis, skin lesion, thin-walled, flaccid blisters filled with a clear fluid, easily rupture, causing itching and painful erosions. Okay, vulgars are easily rupture. Okay, vulgars are easily ruptured. Okay, so pemphigus vulgaris. What type of lesion is this? So this is bullous pemphigoid. Bullous pemphigoid is autoimmune disorder. It starts with an itchy, rash. Large, tense blisters arise on a red, normal skin of the limbs, trunk, and flexures. You can see here, tensed. Easily ruptured vulgaris. Okay, and tense are bullous pemphigoid. What type of lesion is this? Dermatitis herpetiformis. This is dermatitis herpetiformis, and this is prurigo of pregnancy. Okay, C. This pinkish in color. And C. Okay, so this is dermatitis herpetiformis, common in celiac disease patients. So itchy vesicular skin rash on the elbows, extensor surfaces, knees, buttocks, and scalp, often with excoriation, closely related to celiac disease. Okay, so dermatitis herpetiformis. Which type of lesion is this? So, epidermolysis bullosa. Okay, so is a group of genetically inherited diseases characterized by blistering on minimal trauma. Blistering is caused by friction, is mild and limited to hands and feet. Okay, and this is erythema nodosum. Okay, and tender erythematous nodules 1 to 5 centimeter in diameter on external surface of the limbs, especially shins, plus minus ankles and wrist. Okay, what type of lesion is this? Target lesion. So erythema multiforme. Okay, so immune mediated disease characterized by target lesions on the hand and feet. Okay, so erythema multiforme, target lesions. What type of lesion is this? Erythroderma. Also called exfoliative dermatitis, erythema affecting more than 90% of skin surface, potentially fatal. This is potentially fatal, erythroderma. Okay, so these are emergencies of derma. What type of lesion is this? Palmar erythema. Okay. So, generalized reddening of the palms, symmetrical, both hands, non-painful, non-itchy, slightly warm. They are common in hyperthyroidism and in pregnancy. Okay. What type of lesion is this? So, chilblains. Okay. So, chilblains triggers exposure to damp, cold, non-freezing localized swelling, blanchable red pupil, and discoloration. Okay, so chilblains. Okay. What type of lesion is this? You can see here. Okay, so erythema abyegin. Okay, and this is erythema abyegin, reticular pigment erythema due to heat-induced damage. Okay, those who used to who sit in front of heaters. Okay, so they can and they are now more prone to have erythema abyegin. What type of lesion is this? You can see here. Steven Johnson syndrome. Steven Johnson syndrome. Okay, so rare life-threatening drug-induced hypersensitivity reaction, unpredictable, involves skin and mucous membrane, widespread painful areas of epidermal. Okay, detachment. Steven Johnson syndrome. What type of lesion is this? Toxic epidermal necrolysis. Toxic epidermal necrolysis. K10s, a severe form of Steven Johnson syndrome, and it is also a rare life-threatening drug-induced hypersensitive reaction, unpredictable, involves skin and mucous membrane, widespread painful areas of the epidermal detachment. What type of lesion is this? This is mole. Okay, this is mole. Nevus or mole. Common benign skin lesion due to local proliferation of pigment called a brown or black melanocytic nevus contains the pigment melan. And what type of lesion is this? This is patch. Capsulate spot. Okay. This is also congenital. Light to dark brown pigmented birthmarks that commonly appear on a newborn's skin. Spots can change in size and number over time. More than 6 capsulate spots can be a sign of underlying genetic condition like neurofibromatosis type 1. Okay. What type of lesion is this? This is junctional mole. Okay, junctional. Type of mole found on the junction border between the epidermis outer and the dermis inner layer of the skin. These moles may be colored and slightly raised. Junctional mole. Now, what type of lesion is this? This is intradermal mole. Intradermal. Okay. Nets of melanocytes found in the dermal layer of the skin. Intradermal neva are typically raised dome-shaped papules. Okay, you can see here. Okay, skin color, dermal of the skin. What type of lesion is this? This is two colored, so this is compound mole. Compound nevus has nets of nevus cells at the epidermal and dermal junction as well as within the dermis. A central rest area surrounded by a flat patch. Okay, surrounded by a flat patch and center is raised. So compound nevus, compound mole. Okay, so what type of lesion is this? This is epidermide cyst. Epidermide cyst. Okay, benign cyst derived from upper portion of the hair follicle encapsulated in a thin layer of epidermis like epithelium, has a punctum on top. You can see here black punctum on the top. Epidermide cysts are typically filled with keratin and lipid-rich debris. Which type of lesion is this? This is lipoma under the skin. Very common non-cancerous tumor of flat cells slowly growing under the skin in the subcutaneous tissue. What type of lesion is this? This is dermoid cyst. You can see here in the little finger, dermoid cyst. So dermoid cysts are made up of epidermal and dermal components, keratinocytes, hair follicles, and hair and sweat glands. The cyst is usually a solitary form, duff-like lump, 0.5 to 6 centimeter in diameter. Can be of this size. What type of lesion is this? This is keloid scar. Keloid scar. Okay. Keloid scar and enlarged raised scar that can be a pink, red skin color or darker than the surrounding skin. Then can develop after very minor skin damage such as an acne, spot or a piercing, and spread beyond the original area of the skin damage. So keloid scar. And what is this? This is hypertrophic scar. Okay. hypertrophic. These are keloid, these are hypertrophic. So hypertrophic scar is a thick raised scar that's an abnormal response to wound healing, does not extend beyond the margins of wound. Keloid scar is spread beyond the original area. Okay, spread beyond the original area, but hypertrophic scar do not. Okay, extend beyond the margins of wound. What type of lesion is this? This is malignant melanoma. Okay, A, B, C, D, E of the melanoma. So it's a potentially serious type of skin cancer in which there is uncontrolled growth of melanocytes, pigment cells. The first sign of melanoma is usually an unusual looking freckle or mole. Okay, so this is a malignant melanoma. What type of lesion is this? So this is basal cell carcinoma. It starts as a small pearly nodule plus minor surface telangiectasia and rolled margins. What type of lesion is this? Can see here. So actinic keratosis. Actinic keratosis. Precancerous scaly spot found on sun-damaged skin early from a cutaneous squamous cell carcinoma. Solitary often multiple keratosis. A flat or thickened papilla or plugs, white or yellow scoli, warty or horny surface. So these are actinic keratosis. What type of lesion is this? This is Bowen's disease. Bowen's disease, you can see here. Okay, so Bowen's disease is squamous cell carcinoma in situ. No evidence of dermal invasion, typically on lower leg in elderly women, and flat edge, pink or slightly pigmented scalp papules, less than 5 cm in diameter. So Bowen's disease look like that. Okay, common in older age, elderly women. Okay, and typically on lower legs. Okay, and what type of lesion is this? This is squamous cell carcinoma. Okay, this is actinic keratosis, and this is squamous cell carcinoma. Okay, so squamous cell carcinoma is second most common skin cancer after basal cell carcinoma. Usually delivers in skin exposed to sun. Okay, and may start within an actinic solar keratosis or de novo. Okay, what type of lesion is this? So this is lentigo maligna. Okay, it is not like a melanoma, malignant melanoma. Okay, a malignant melanoma looks like this, and this is lentigo maligna. Okay, so there is difference. Lentigo maligna is an early form of melanoma in which the malignant cells are confined to the tissue of the origin, the epidermis. Hence, it is often reported as an in situ melanoma. It occurs in sun-damaged skin, so is generally found on the surface and on the face or neck, particularly the nose and cheeks. Okay, so as it is here, it is on the cheek. Okay, so I tried my very best to make video on Derma slides, so you can watch at your desired speed, and I wish you very best of luck for your exams. Okay, so rapid. This is a rapid avian allergic contact dermatitis. This is contact irritant dermatitis, and this is nickel allergy. Okay, and this is contact allergic dermatitis. You can see in contact. Okay, so what type of eczema is this? And this is nummular eczema, also called disc bite. And this is hyperkeratotic eczema. You can see a thickening and scaling. And this is atopic dermatitis. Okay, it can have associated with asthma patients. And this is cradle cap dermatitis, seborrheic dermatitis. Okay, and this is urticaria, and this is pityriasis alba, plantar psoriasis, palmar psoriasis, astotic eczema, lichen simplex chronicus, pomfolix, palmoplantar pustulosis, psoriasis, lichen planus. Okay, and goutte psoriasis, lichen simplex chronicus, alopecia areata, exclamatory marks hairs will be found on the skin. Discoid lupus, stasis eczema, Auspitz sign in psoriasis, Nobner phenomena, impetigo. Okay, and yeah, herpes labialis, herpes simplex virus 1 is involved. This is folliculitis. Each follicle is filled with the pus, so folliculitis. This is furuncle, deep. Okay, this is deep form of bacterial folliculitis. So deep is furuncle, single is folliculitis, and if it is and when there are so many heads, multiple heads in a boil, okay, so it's called carbuncle. Okay, so this is carbuncle. Okay, so this is hidradenitis suppurativa. Okay, this is herpes zoster. Okay, and this is basal cell carcinoma, and this is ecthyma, and this is erythema. You can see difference. This is erythema, okay, and this is ecthyma, and this is hidradenitis suppurativa. Okay, so there is difference. This is erysipelas, borders are sharp. Okay, this is cellulitis, borders are dull. You can see here. Okay, and this is erythema, and this is tuberculite leprosy. Okay, single anesthetic patch, and this is lepromatous leprosy, not anesthetist. This is borderline leprosy. This is common. These are common warts. You can see here. These are plain warts, and filiform warts. Okay, filiform, and these are plantar warts. This is corn. Okay, it is painful, and this is callus. Okay, this is callus. This is not painful. It is painless. Herpes gingivitis, molluscum contagiosum, skin colored, umbilicated. You can see center is depressed. Okay, so umbilicus center. Okay, and this is orif, milcus nodule, sunburn, suntan, herpetic whitlow. Okay, and Addison's disease, darkening of the skin. This is melasma, mask of pregnancy, vitiligo, acanthosis nigricans, common in hypothyroidism, obese and diabetic patients. Albinism. Okay, comedonal acne with open comedones. Open comedones are black in color and closed comedones are white in color. So these are closed comedones. And pustular acne, papillopustular acne, nodulocystic acne, and this is acne rosacea. Okay, and this is severe form of rhinophyma. Okay, so main complication of untreated rosacea is rhinophyma. Okay, bumpy, bulbous, enlarged nose, rhinophyma. This is contact dermatitis, SLE, butterfly rash, seborrheic dermatitis, perioral dermatitis, acne fulminans, Mongolian spot, milia, neonatal milia, infantile acne, erythema toxicum neonatorum, okay, nevus flammeus, port wine patch, okay, transient neonatal pustular melanosis, transient neonatal melanosis, pustular melanosis, strawberry nevus, you can see color so, and this is simplex nevus, nevus simplex, okay, infantile acropustulosis, infantile acropustulosis, and transient neonatal pustular melanosis, difference है, okay, and hand foot mouth disease, Coxsackie virus is involved, erythema infectiosum, slept disease, parvovirus B19, striae gravidarum, polymorphic eruption of pregnancy, linea alba, if white, linea nigra when dark color, okay, prurigo of pregnancy, and this is dermatitis herpetiformis. This is bullous pemphigoid when tense fluid filled, and this is vulgar. Vulgar is easily ruptured, and pemphigoid gastationis. And this is epidermolysis bullosa, epidermolysis bullosa, erythroderma, palmar erythema, chilblains, erythema nodosum, okay, target lesions, erythema multiforme, erythema abyegene, toxic epidermal necrolysis, and Steven-Johnson syndrome. This is a severe form of Steven-Johnson syndrome. This is small, this is capillate spot, and if more than 6, then genetic there may be underlying genetic condition like neurofibromatosis type 1. This is junctional mole, this is intradermal mole, and this is compound mole. This is lipoma, this is epidermoid cyst with punctum, dermoid cyst, keloid scar extending the border, hypertrophic scar, this do not extend the border. This is a malignant melanoma, and this is a lentigo maligna, actinic keratosis, basal cell carcinoma, Burns disease, and squamous cell carcinoma.